Hello, welcome to MedZone by Dr.farjana Afrin. Today my video lecture topic lumbar plexus and lumbosacral plexus. In this video lecture I am going to describe detail about the lumbar plexus formation, its arterial supply, location and prefix and postfix lumbar plexus meaning, what is the meaning of nervi furcalis, different branches of the lumbar plexus along with its root value. I am also going to describe about the lumbosacral plexus forming nerve roots, their division, each division branches and supplying muscles. So, let us start. First, we have to know what is the meaning of lumbar plexus. So, we have to remember in book according to definitions what we are getting ventral rami of L1, L2, L3, L4 together with ventral rami of thoracic 12 form the lumbar plexus. Here 2 points we have to remember, ventral rami of L1 to L4 and again ventral rami of T12. That is the lumbar plexus forming structure. Now, before starting the supply location, we should have very good explanation about this ventral rami. We know our nervous system. The nervous system divided into two, central nervous system and peripheral nervous system. Central nervous system again divided into two, one is brain, another one is spinal cord. Peripheral nervous system, it is communicating with the central nervous systems by the help of sensory and motor component. Sensory again have two type of sensory, one is general sensory, I am writing in shortcut, another one is special sensory. And motor have two, one is somatic, another one is autonomic. Today our topics of discussion is actually somatic nerve. Now, first of all, we have to remember our brain and spinal cord. That is the central nervous system part. If we think about the spinal cord, it has different segment. It has cervical, thoracic, lumbar, sacral, coccygeal segment, and the spinal cord actually finished into the lumbar area. After that, there will be the prolongations of pyometer only going to the sacral and coccygeal region. Now, mainly we are concerning about the thoracic region for some time. Think like, if in the thoracic segment we cut transversely the spinal cord, what will be the transverse section showing? In transverse sections of the spinal cord, we are going to get like this one picture. This is the anterior median fissure and this is posterior median sulcus. That means this is the anterior or ventral segment area of the spinal cord and this is the posterior or dorsal segment of the spinal cord. Inside this spinal cord, we will get a grey matter area. It is divided actually into two, grey matter and white matter. So, now I am drawing the grey matter area. The grey matter, inside there is a central canal. As like horn like, so this anterior aspect, so I can say this is ventral horn, two ventral horn in both sides, lateral horn both sides and dorsal horn. Now, from dorsal horn some small nerve rootlets are uniting, some ventral horn also same, some nerve rootlets are uniting and coming outside and it will be unite. The ventral and dorsal nerve rootlets are uniting. From dorsal horn it is coming, so we are saying it is called dorsal root. From ventral horn it is coming, so we are saying it is called ventral root. On the dorsal root area there is a ganglia also. So, from spinal cord, dorsal root and ventral root they both unite and form a nerve that is called spinal nerve. From a spinal cord it is formed, that's why it is called spinal nerve. Now each spinal nerve, it will be again divided into two. One coming front, that is called ventral rami, and one go back, that is called dorsal rami. These dorsal rami go back sides and supply to the backside muscles, and ventral rami come front side and supply to the front side muscles. These are somatic nerve. Soma means body wall. They are supplying, these nerves are supplying to the body wall muscles. That's why we are saying it is called somatic nerve. So dorsal rami and ventral rami. For some moment think like this drawing what I have done and the transverse section is spinal cord what we had taken, it is at the level of thoracic 12. So number of the spinal nerve also will be thoracic 12, and this ventral rami is also thoracic 12. After thoracic 12 there should be lumbar 1, then lumbar 2, then lumbar 3, and then lumbar 4. They all are uniting. They all are uniting and they are forming this plexus. Now what is the name of this plexus? This is the lumbar plexus. So lumbar plexus, it is formed by the ventral rami of T12, L1, L2, L3 and L4. They united with each others and forming this plexus. So as I said in the definition, the ventral rami of L1, L2, L3, L4 together with the ventral rami from upwards one nerve, that is the thoracic 12 ventral rami, they form this lumbar plexus. So definition and explanation of the definition now we got. Now next topics is where they are located, this whole plexus where they are located. So location. Now on screen you can see there is a figure. In this figure the different muscles are here. We have to mainly focus on this muscle. Name of this muscle is called psoas major muscle. The commencement of the psoas major muscles area, these nerves are plexus are located. So it is located on the commencement of the psoas major muscles in front of the lumbar vertebra transverse process. Now you see this is sacral. So over the sacrum this is lumbar 5, this is lumbar 4, this is lumbar 3, this is lumbar 2 and this is lumbar 1 and these are all transverse process of each lumbar vertebra. So just in front of the transverse process of the lumbar vertebra also it has relation. So where it is located, its location into the commencement of psoas major muscle in front of transverse process of lumbar vertebra. The next things we have to know the arterial supply of the lumbar plexus. The arterial supply, it's coming either directly from the branches of the abdominal aorta or maybe some branches of the abdominal aorta, their branch will be supplied to the lumbar plexus. So what are that? Number 1, lumbar artery. Lumbar artery, it's a direct lateral branch of abdominal aorta. Number 2, iliolumbar artery. Iliolumbar artery, it's a branch of internal iliac artery. Internal iliac artery is a branch of common iliac artery and common iliac artery again in turn branch from the abdominal aorta. Number 3, as it is over the psoas major muscle, the artery which is supplying to the psoas major, that also will be supplied to the lumbar plexus. So artery supplying to psoas major muscle. So that artery also will be supplied to the lumbar plexus. Some artery name you just can remember as a nice to know, like deep circumflex artery. One branch will be come from deep circumflex artery. Then branches are coming from femoral artery. Branches are coming from obturator artery also. So from here branches are coming to supply to the lumbar plexus. The next things what we are going to learn is what about prefix and postfix. So there are 2 points we have to remember. Now the next things we are going to learn is the prefix and postfix. Now related with the prefix and postfix, we have to remember if L3 form the nervi furcalis, then we will say it is called prefix. And if L5 is forming the nervi furcalis, then we will say it is called postfix. Now, of course, question will come in our mind, what is this nervi furcalis? So, let us learn nervi furcalis. Nervi furcalis is the ventral rami of the fourth lumbar vertebra. Sometimes we are saying it is called nervi furcalis. Now, why we are saying nervi furcalis? Think like for some moment, this is the lumbar fourth, ventral rami of the lumbar fourth. Now, it has two part. One part will be helps in contribution of forming the lumbar plexus, and another part it will be joined with the, we know after L4 of course there should be L5, join with the L5 and helps in even join with the S1, S2, S3, S4 also to form lumbosacral plexus. So, this nerve, it is important because it has contribution on lumbar plexus formation and as well as it has contribution in forming the lumbosacral plexus also. That is why we are saying it is called nervi furcalis. Now, think like if instead of L4, L3 comes to do like this work to form lumbar plexus as well as lumbosacral plexus, we will say it is called prefix lumbar plexus. And if it is coming from L5, L5 have one section for lumbar plexus and another section for lumbosacral plexus, then we will say it is called postfix lumbar plexus. Now, we are going to learn the lumbar plexus drawing. First, there is root. Root are T12, L1, L2, L3 and L4. T12, L1, L2, L3 and L4. So, T12 already we know it is subcostal nerve forming. Now, from T2, one small supplemented twig will come and join with the L1. Join with the L1, the ventral rami of L1 supplemented by the twig from T12, subcostal nerve. And it is divided into two. One is the large upper branch, this is the upper branch which is larger, and one very small branch, this is the lower branch. Okay. Now, upper branch again divided into two. One is called iliohypogastric nerve. Another one is ilioinguinal nerve. Then the smaller this lower branch, it will be getting a twig from the L2 and now it will form a branch. What is the name of this branch? It is genitofemoral nerve. Now, the all remaining L2, L3 and L4 remaining. All the remaining L2, L3 and L4, they are divided into two. One is called ventral division, another one is called dorsal division. Each of them divided into two, ventral division and dorsal division. Now, we have to join them. Just remember, all the ventral will be unite. All the ventral will be unite. All the ventral will be unite and form a nerve, and that is called obturator nerve. Similar, all the dorsal will be also unite and forming a nerve. What is the name of this nerve? It is called femoral nerve. These are the main lumbar plexus different branches. Two more branches are also we are getting. One is the lateral cutaneous nerve of thigh, which is coming from the dorsal division of L2 and L3, and accessory obturator nerve, which is coming from the ventral division of L3 and L4. So, let us see, I am changing the color, these two nerves we are drawing, we are going to draw. One is the dorsal division of L2 and L3. Let us see, this is the dorsal division of L2 and this is the dorsal division of L3. From here, one branch will be arise, and name of this branch we are saying it is called lateral cutaneous nerve of thigh. And From the ventral there will be one more branch coming, as ventral all are joining and forming obturator nerve. So here also ventral will be join and form. The ventral from L3 and L4. The ventral from L3 and L4. This will be unite and again forming a branch. What is the name of this branch? Accessory obturator nerve. These two you just remember. Ventral, L3, L4, they join and form this accessory obturator nerve, and the dorsal of L2 and L3, it will be unite and form the lateral cutaneous nerve of thigh. That's all about the lumbar plexus related branches. Now, how we can remember this all very easily? There is a mnemonics which will be helping us to remember this all the nerves and root value. So, let us learn that one. The mnemonic is I2A golf. So, first come for I ilio hypogastric nerve. Again I, as there is 2. So, it is ilio inguinal nerve. A, accessory obturator nerve. Then G for genitofemoral nerve. O for obturator nerve. L for lateral cutaneous nerve of thigh, and lastly F for femoral nerve. Now, let us discuss about the root value. We already know iliohypogastric and ilioinguinal will be the lumbar 1. Then the accessory, it will come from the L3 and L4. Which division? Ventral. Then genitofemoral, it is also having L1 then L2. Which division? Ventral division. Obturator, its root value will be L2, L3 and L4. It is also ventral division. Then lateral cutaneous nerve of thigh, it is coming from the dorsal division, we know it is L2 and L3. It is coming from dorsal division. Then lastly the femoral nerve, its root value also L2, L3 and L4, and it also coming from dorsal division. Sometime the teacher may ask you a question that the obturator nerve and the femoral nerve, both have same root value. How? You just say the answer. The obturator nerve is coming from the ventral division and the femoral nerve is coming from the dorsal division. But root value is same, but they are coming from the different division. That's all related with the mnemonics to remember the different nerves coming from the lumbar plexus with its root value. Now let's see area of distribution. First, iliohypogastric nerve. Iliohypogastric nerve name is gastric, so it will be supplied to the hypogastric region. In the abdomen, cutaneous innervation will be given to hypogastric region. In the anteroabdominal wall, the hypogastric regions, it will be giving cutaneous supply, plus in the gluteal region also. So, in both cases it will give cutaneous supply. Next, ilioinguinal nerve. Ilioinguinal nerve, it has two supply, motor and sensory. Motor supply will be to the anteroabdominal two muscle, one is internal oblique muscle, another one is transverse abdominis muscles, and sensory supply will be the medial aspect of the thigh. and even root of the penis and scrotum in the male, means genitalia area externally, and labia majora in female, and mons pubis also. So, external genitalia skin. In case of male, it will be root of the penis and scrotum exine, and in case of female, mons pubis and labia majora. Next, genitofemoral nerve. Genitofemoral nerve, I am writing in shortcut. It has two branches, always remember. One is the femoral branch, another one is the genital branch. The femoral branch, it will be innervate the femoral triangle area structures, skin over femoral triangle, and the genital branch, it will be supplied to the cremasteric muscles, scrotal skin, and skin of the mons pubis and labia major, same like the ilioinguinal also supplying. Next will be the lateral cutaneous nerve of thigh. Lateral cutaneous nerve of, I am writing in shortcut, thigh. The lateral cutaneous nerve of thigh, by name we can understand lateral aspect of thigh cutaneous supply. Next, we are going to get about femoral nerve. I am writing in shortcut. Femoral nerve, it will be supplied to the anterior compartment muscles, anterior compartment of the thigh muscles, as well as the hip flexor also. What are that? The hip flexor will be iliopsoas, then pectineus, then sartorius, then quadriceps. Quadriceps have four: vastus lateralis, vastus medialis, vastus intermedius, and rectus femoris. Next, obturator nerve. Obturator nerve will be supplied to the medial compartment of the thigh muscles, the all adductor muscles, adductor, longus, brevis, half of the magnus also, and obturator externus and gracilis. And obturator externus. Now, we are going to learn about the lumbosacral plexus. Again, it is formed by the ventral rami. We know already what is ventral rami. Ventral rami from L4, L5, S1, S2, S3 and S4. Now, let us do the drawing. For our help in purpose of descriptions, I will be now make the root in the middle. So, this is L4, this is L5, S1, S2, S3 and this is S4. From each rami there will be two division. I am writing in both sides. These are the two division. One is dorsal division, another one is ventral division. Okay. So, this side dorsal division and this side ventral division. Now, let us see what are the branches coming. As dorsal division have less, so let us first start from the dorsal. You have to remember from each we will go 3 up. So, from if S1 I start, S1, L5 then L4. So, the nerve is formed by the L4, L5 and S1 ventral rami, dorsal division. So, name of this nerve will be superior gluteal nerve. And again from S2, S1 we will be jump to 3 nerve only. So, what is the root value? L5, S1, S2. This is inferior gluteal nerve. Then again from S2, now we will be jump only 2. So, S1, S2. It will be nerve 2 pyriformis. So, superior gluteal nerve, what is the root value? Root value is L4, L5, S1. What is the root value of inferior gluteal nerve? L5, S1, S2. And what is the root value of nerve 2 pyriformis? S1 and S2. That's all about the dorsal division. Now, for the ventral division, I just made a mnemonic N2, P2, N. Again, we will go for roll of 3. We are starting from S1. So, S1, L5, L4. So, L4, L5, S1, it's from a nerve. Name of this nerve is nerve to quadratus femoris. Nerve to quadratus femoris. I am writing in shortcut. So, what is its root value? Root value is L4, L5 and S1. Again, from the S2 we are going to start. Again we will go to 3. So, L5, S1, S2. This name is nerve to obturator internus. Nerve to obturator internus. What is its root value? Root value is L5, S1 and S2. Again we will go 3. So, from S3 we are starting S3, S2 and S1. S1, S2, S3. Name of this is posterior cutaneous nerve of thigh. So, what is its root value? S1, S2, S3. Then, now we are going to start for pudendal nerve. Pudendal nerve we will see again start from S4, S3, S2. So, S2, 3, 4. This nerve we are saying it is called pudendal nerve. So, what is the root value of pudendal nerve? S2, S3 and S4. Next again same like the dorsal we will be only taking 2. Name of this is called nerve to coccygeus. What is the name of this nerve? Nerve to coccygeus. What is its root value? Very easy, S3 and S4. As I said, N2, there are 2 N. First is nerve to quadratus femoris, next is nerve to obturator internus. Then P2, posterior cutaneous nerve of thigh and pudendal nerve. Then only N, nerve to coccygeus. So, these are the ventral and dorsal division branches from the lumbosacral plexus. Now, other than there is a big nerve also coming from here, that is called sciatic nerve. Now, I will change the color and I will make you understand how it is forming. First, from the dorsal division from L4, L5, S1 and S2, it will be unite and there is a branch coming. Again, from the ventral division of L4, L5, S1, S2 and S3, this will be making a nerve. Now, you just see on dorsal division area, this is the dorsal division of L4, 5, then S1 and S2, and this will be forming a nerve, and this is the common peroneal part. Common peroneal part. And if we see the dorsal ventral division, the ventral division will be here. If we see the ventral division of L4, 5, S1, S2 and S3, they will be unite, and this part we are saying it is called tibial part. So, in sciatic nerve actually there are 2 parts, one is the common peroneal part, another one is the tibial part. They both will be unite. Now, it will be called sciatic nerve. So, this is the sciatic nerve which has 2 parts, one is the common peroneal part, another one is the tibial part. and common peroneal part root value is coming from the dorsal division of L4, L5, S1 and S2, and tibial part is coming from the ventral division of L4, L5, S1, S2 and S3. So, that is all about the lumbosacral plexus drawing along with its different branches. Now, let us learn each of the branches area of innervation. First, let us start with the dorsal division. In dorsal division, there are two branches. Let us start superior gluteal nerve. I am writing in shortcut. Superior gluteal nerve will be supplied to muscle gluteus medius, then gluteus minimus and tensor fasciae lata. These are the muscles supply. Next, inferior gluteal nerve. Inferior gluteal nerve, it will be supplied to the gluteus maximus. Then nerve to piriformis, by name we can understand it should supply to the piriformis muscles. So, it will be supplied to piriformis muscles. Even it also have a contribution to form the superior gluteal nerve. So, in that case it may supply to the muscles which is supplied by the superior gluteal nerve also. Now come for the ventral. Ventral division, there are some nerves, let us summarize. Number 1, nerve to quadratus femoris. Nerve to quadratus femoris will be supplied to the number of muscles. What are that? The quadratus femoris muscles. We know it has 4 parts. The vastus lateralis, vastus medialis, vastus intermedius and rectus femoris. Plus it will be also supplied to inferior gemini. Inferior gemini muscles. Then number 2, nerve to obturator internus. Nerve to obturator internus will be supplied to obturator internus muscles. By name we can understand obturator internus muscles and superior gemini. Number 3, nerve pudendal nerve. Pudendal nerve, it will be supplied to the external genitalia. The voluntary controls of the pelvic floor muscles also will be sensory supplied to the external genitalia, skin, perineal regions, and motor supply to the pelvic floor muscles also, external anal sphincter also, urethral sphincter also. So, external genitalia will be the cutaneous supply and the motor supply will be the pelvic floor muscles. It will be the motor supply and external anal sphincter also. External anal sphincter also will be supplied by the pudendal nerve. External urethral sphincter also. External urethral, so sphincters it supply also by the pudendal nerve. Then nerve to coccygeus. Nerve to coccygeus. This nerve to coccygeus, by name we can understand it will be supplied to the coccygeus muscles. Lastly, there is also a nerve that is called posterior cutaneous nerve of thigh. Now, by name we can understand it will supply to the posterior aspect of the thigh. Aspect of thigh. Which supply? Of course, cutaneous supply. Cutaneous supply will be there. That's all about the lumbar plexus and lumbosacral plexus related information. Thank you all for listening.